Had I given this talk 2 days ago, it would have been much more fluid. But the truth is, after spending a day and a half here, I've learned a lot. I probably would say a lot of things differently. It's been a wonderful few days. I sold my business a few years ago and then had nothing better to do than go be a cosmonaut in training in Russia. And I had a wonderful time. I had no real day job. And one thing I did was to sign up to be a judge for the Healthcare X Prize, which, however, never happened. But it did get me thinking more and more about health. But health is really like just a repair job, and that's extremely expensive. This is a chart from my new CEO explaining how we spend our health dollars and how little they actually produce. Just as Chris was saying, the real win is in things like extermination, asthma prevention. On the other hand, quantified self. That's prevention for rich people. So I began to think that somebody should do something that would figure out, and I was going to give a talk saying, somebody should do something. And then I realized that is a really terrible talk. So I basically bluffed myself into announcing that I would do it, because after all, I had no day job. And then I did a bunch of brainstorming sessions to figure out what, in fact, was I going to do to make the production of health a business model. And decided to do essentially a demonstration project, which my new CEO, God bless him, changed our name from HICCup, for Health Initiative Coordinating Council, to the Way To Wellville, which is a little more understandable. It was originally, like the X Prize, going to be a contest. But the communities that we were working with told us, we really want to be in this thing together. We don't want to beat each other's brains out. We want to learn from each other, because this is a long journey and we don't know where we're going. The problem is most health interventions are like peeing in a reservoir, no photo. But what we are doing is we're pouring rose water into 5 bathtubs. And these are beautiful Wellville communities, including Clatsop County up in Oregon and Lake County, just an hour north of here when the traffic is good. They are wonderful places, and our core constituents, even when the adults have lost hope, even when they're the people who have no time, the caregivers who are too busy, they all want a better life for their children. They want better school lunches. I'm sampling the school lunch in Clatsop. It was terrible. We're hoping that we can be a laboratory for food companies, because if it's not profitable to sell healthy food, fundamentally we're screwed. And what we are doing as collective action in our communities, which may involve subsidizing vegetables, it may involve doing special deals with McDonald's, eventually needs to turn into government interference. I've also learned not just about hospital-acquired infections, but jail-acquired insolvency. It is a huge problem. And we're getting the health services to work with the mental health services. We're also helping these communities understand trade-offs and return on investment. If you invest so much in asthma prevention, can you then take that saved money and use it for something else? We're also working on business models that are very complicated, with the people who put the money in not necessarily being the people who benefit. But there's got to be a way to get some of those cost savings back to investors so that we can build not just new age insurance companies, but also social impact investing. We want to turn social impact bonds into a standardized set of financial instruments so that all those rich people who actually do want to invest in health will have a way to do it. And we want to evaluate like crazy. Thank you very much.